Good afternoon, ladies and gentlemen. Today on Busting the Myth, we'll be talking on Staphylococcus aureus. It has cost so many persons money, it has cost so many persons anxiety, it has cost so many persons emotional stress, it has cost so many persons their time. In fact, so many persons have lost their hard-earned money. Some persons have even lost their relationship because of Staphylococcus aureus. Now, what is Staphylococcus aureus? Staphylococcus aureus is just a normal bacteria. It belongs to the family of Staphylococcus. We have different type of Staphylococcus. We have the Staphylococcus epidermis, we have the Staphylococcus aureus, which is even what is found on the skin. Anywhere hair grows, Staphylococcus aureus is found there. Your pubic region, your hair, your scalp, your armpit region, your pubic region, anywhere you have growth of hair, you have Staphylococcus aureus. It's a normal human bacteria that causes no harm. It causes no harm at all. It causes no harm. The only time you find out that Staphylococcus aureus is causing problem is even on the skin, on the scalp, not even on maybe on the pubic region. What does it cause? Boils, furuncles, carbuncles. This is what it causes. And this only happens when your immune system is dropped, when you have a lower immune system. This is the reason why Staphylococcus aureus boils are common amongst people who are diabetic, people who are HIV, people who are passing through stress, emotional stress and all this, because your immune system have dropped, and as a result of that, your hair follicles becomes affected and you have what we know as furuncles, also known as boil. Clusters of furuncles called carbuncles, they are all infections from Staphylococcus aureus. It's boil, nothing else. It does not cause, it's not a sexually transmitted infection. So when anybody asks you, you go and someone say you have Staphylococcus aureus, ask him, I have Staphylococcus aureus, then what is the management? What is the pathological? What is the pathology? How does Staphylococcus aureus present? Staphylococcus aureus is a normal bacteria found in everybody. Now, someone will ask, why do we have Staphylococcus aureus when we go to the lab? Let's say we go and do higher vaginal swab, or we do endocervical swab, and Staphylococcus aureus will grow after 24, after 72 hours, after 24 hours. They will say it grows, a high growth of Staphylococcus aureus. The reason being that during the process of collecting swab, putting the swab inside you to collect sample, the swab is contaminated by the Staphylococcus on the vulva, on the pubic region. It is contaminated, and this is the reason why it grows Staphylococcus aureus. It's not causing any problem, and this is the reason why when you go to the lab, you go to the hospital and you submit your results, laboratory result, and the doctor sees it grows Staphylococcus aureus. It's not bothered because it's not causing any problem. It's a normal human bacteria that grows in everybody. It only becomes important when you have infection, when you have diseases like diabetes, HIV, cancer, you are on chemotherapy. This is when we become worried, because it will cause more diseases like what? Infective endocarditis. It can cause serious disease like sepsis. These are the diseases that are even much more serious than even the sexually transmitted infection they are talking about. Staphylococcus aureus is not amongst the thousands of hundreds of organisms that can cause sexually transmitted diseases. So when next you see Staphylococcus aureus grow in your samples, don't be worried. There's no cause for alarm. If you have vaginal discharge, or you have vaginal itching, or you have a purulent vaginal odor, it is not the Staphylococcus aureus that is causing this. What is causing this is there. It could, most times, even bacterial vaginosis will cause foul smelly odor that smells like fresh fish. Sometimes the itching is even Candida albicans that is causing the itching. If it is greenish, it is maybe Trichomonas vaginalis that is causing the itching and the smell and the greenish discharge. If it is brownish discharge, it could be maybe blood old blood, stale blood that have not finished after your period, that is making your period to be brownish. So Staphylococcus aureus have cost so many persons money because the herba guys and people who don't understand, who don't even know medicine, have decided to start scamming even educated people, because they now know that if you go to lab, you grow. Anytime you go to lab, it is very easy to grow Staphylococcus aureus. So they have, decide to use that as a scamming techniques to scam you of your hard-earned money. So please, Staphylococcus aureus do not cause erectile dysfunction. There are reasons why someone will suffer from erectile dysfunction. Staphylococcus aureus do not cause low libido. Staphylococcus aureus do not cause infertility. I've discussed infertility before. You go to my YouTube pages, you see the cause of infertility. Staphylococcus aureus do not cause waist pain. All these are not cause of these. All these are not caused by Staphylococcus aureus. So when next you see somebody is telling you that the reason why you are not giving birth to your children is because you are infertile, is because of Staphylococcus aureus, tell that person it's a lie. It's a bloody lie. The person is telling lie. He just want to scam you, want to sell herbal medications for you. Thank you so much. Bye.